Hyperbaric oxygen therapy is a modality that we use to help healing. Basically, a patient is put in a chamber with 100% oxygen, and that oxygen is forced into their tissues under pressure. The way we do that is we submerge them so that you feel like you're going down in a submarine. And at 30 or 60 feet, the oxygen pressure is much higher and it goes into your tissues. Hyperbaric oxygenation has a whole host of effects that aid wound healing, aid immunology, and hopefully are an adjunct to what we're doing. It's one of the things that we do to get patients to heal a lot faster. The chamber is basically a glass tube so that you're either sitting up or lying down, you're watching television or listening to your favorite music. Unfortunately, you can't read in the chamber because you can't take anything in that might be combustible, like paper. You go in a cotton gown. You can't take anything else with you. But you do lie there and relax for about an hour and a half. And you feel like you've gone down in a submarine or sometimes back up in a submarine. It lasts about an hour and a half. It's usually a very pleasant experience, but it is a commitment because it has to be done 5 days a week, and very often for 20 to 40 treatments. What we treat basically are diabetic wounds. We treat people with radiation problems. In other words, people who have had radiation to treat cancer will come in with problems with that tissue, and we can treat that successfully with hyperbarics. There's what's called potential loss of flap. In other words, if your plastic surgeon has done a procedure where he's moved skin around, or your cancer surgeon has done a procedure where he's moved skin around, and that skin looks like it's going to die because it doesn't have enough oxygen, hyperbaric oxygenation can help save that. We have people who have what we call acute arterial ischemia. In layman terms, that means that you've lost the blood supply acutely. And although you've gotten back the blood supply, that area that lost it is damaged. So until you can heal that area, hyperbaric oxygenation is a bridge that helps you get by and keeps those tissues alive until the blood supply can get back down there. We use it again primarily for diabetic ulcers. And for a whole host of reasons, it seems to reverse some of the poor effects of diabetes and allows these wounds to heal a lot faster. The timing of hyperbaric oxygenation after surgery is very often immediate. As soon as the patient leaves the hospital, sometimes even while the patient's in the hospital, it's appropriate to start hyperbaric oxygen. And it's well tolerated by the patient, so that's not a difficult decision. We've even had acutely ill patients who are on respirators go into the hyperbaric chamber and tolerate it very well. So hyperbaric oxygenation can be started any time, but sometimes it has to be done acutely, immediately in the postoperative setting. There are complications to hyperbaric oxygenation. People can have some problems with their ears because, again, you're being submerged. There are very temporary visual problems. Occasionally there might be a headache. But for the most part, it's very well tolerated. We take people to depth at a very slow rate, and we monitor them very closely. There's always a certified nurse and physician right there at their bedside. And quite honestly, if the patients want their families to sit there with them, they can. There's a telephone that you can communicate with, or you can just watch TV together.